Hello and welcome. In this video, basic concepts to interoperability are introduced. By the end of this lesson, learners will be able to define the term interoperability terms, understand how interoperability works, describe the different types of interoperability. Introduction to interoperability. Interoperability refers to the basic ability of different computerized products or systems to readily connect and exchange information with one another, in either implementation or access, without restriction. Interoperability is the property that facilitates unrestricted sharing and use of data or resources between disparate systems via local area networks or wide area networks. How does interoperability work? For two or more systems to be interoperable, they must be able to exchange, interpret, and present shared data in a way that is understood by the other. This is accomplished with the establishment of syntactic interoperability, which involves adopting a common data format and common data structure protocols, followed by semantic interoperability, which involves the addition of metadata that links each data element to a controlled, shared vocabulary. In the domain of healthcare, we build specialized systems to solve multiple problems. For example, the figure depicted shows that a laboratory information system, LIS, has a specific set of problems that are not applicable to the electronic medical record system, EMR, even though there is some overlap. EMR system, an EMR, can generate a lab order, but the EMR will not track that order as it's processed through the lab. Laboratory system, a laboratory consumes reagents, but it should not be responsible for tracking the process of procuring those reagents. Healthcare workers in the field, the clinic's EMR doesn't need to manage the local community health worker team, but the data collected by the community health workers in the field should be available to a doctor if a local patient comes for a clinic visit. Stock management system. The stock management system isn't responsible for tracking the patients that received vaccinations at the facility. Basic kinds of interoperability. There are three basic kinds of interoperability: human-mediated, point-to-point, and standardized. 1. Human-mediated interoperability. Human-mediated interoperability can be thought of as information moving between systems, based on human interventions, such as data entry. Example of a human-mediated interoperability is that, during a patient examination, the nurse takes notes on a paper form. At the end of the day, he sends all the examination forms to the data clerk, who enters the data in the hospital's electronic medical record system. The paper system, nurse's paper forms, is interoperable with the electronic medical record. The data clerk is the human-mediated connection between the two systems. 2. Point-to-point or exchange. Point-to-point or exchange interoperability means two or more systems can request and receive information from each other. An example of point-to-point or exchange is that the data manager at hospital receives a request for patient information from another hospital. She generates the patient summary report from his hospital's electronic medical record system. She then selects the option to send the report electronically to the other hospital, which then uploads the report into its own record system using a specially designed software feature. 3. Standardized interoperability. Standardized interoperability means two or more systems can exchange information that is usable without further transformation to the data within each system's respective context. An example of standardized interoperability is that a clinic's reporting system aggregates the monthly reports and the user can click a button to automatically send the data to DHIS2. This example uses the latest aggregate data exchange standard, ADX, that is being validated within HL7's FHIR standards. The Aggregate Data Exchange, ADX, profile enables interoperable public health reporting of aggregate health data. ADX will typically be used to represent routinely reported aggregate data such as the numerators and denominators, which can be used in the construction of public health indicators. This concludes the lesson. Thank you for watching.